Hello, I'm just coming into work. It's Saturday. I've got a 12-hour shift.
400 miles from her home in Sheffield, Dr. Annie Evans begins her shift at the Queen Elizabeth University Hospital in Glasgow.
So it's always pretty busy.
She is just 25 and started her career just months ago.
It's always going to be difficult to start as a doctor, but when you have to start as a new doctor in a new city, in the middle of a pandemic, and you don't really know anyone, then it was always going to be difficult.
The hospital say junior doctors have had the most challenging year.
There are more people that do die in the hospital, and sometimes that can be quite difficult if you're having to go in and see that just because you want to help people get better, so it can be quite demoralising when you have to kind of experience lots of death all at the same time.
Why do you think I'll be home?
Hopefully soon.
Dr. Rory Campbell has been working on the high dependency unit.
Like everyone else, we've struggled with not being able to see our family and our friends. So I think that's been quite tough on people. It's not just the work, but it's when you come home. It's been difficult to switch off.
It's been a year of first experiences. In between shifts, Rory has documented some of them.
I remember the first time we had to speak down the phone and say that, it was not good news. And I remember catching myself. They asked me the question, is my relative going to die? And it's a tough question to answer.
Dozens of junior doctors work here at the Queen Elizabeth University Hospital in Glasgow. It's the biggest teaching hospital in the country. Over the past year, the hospital has felt the full force of the pandemic, with junior doctors dealing with a large number of coronavirus patients.
Multiple family members or friends can often be very sick at the same time. Dealing with situations where relatives have passed away, or you come home and you think, well, this could be my mum and dad, this could be my granny and granddad. It can feel quite heavy at times.
Pandemic pressures mean access to training has been limited, and senior consultants can only do so much to mentor their junior colleagues.
When normally they would look to us for guidance and advice on how to treat these diseases, we've had to learn with them about how this disease has developed. And I think that has also changed the way we look at junior doctors and at trainees. Clearly, we're very aware of their needs for training and for education, but we do look at them more now as able colleagues, I think.
Colin says this will be a generation of doctors with support and well-being at their heart.
Hi there, Rory.
And has it made you realise that this is 100% the job for you?
Absolutely. No, I feel exceptionally privileged to do this job. It's a wonderful job, and although there are tough times in it, I wouldn't change it for the world.
Although it was difficult moving to a new city and not really knowing anyone, I think that the risk has paid off.
Polly Bartlett, STV News.